activist organization Treatment Action Campaign says the U.S. decision to cut the president's emergency plan for AIDS relief, PEPFAR, the funding cuts threaten millions of lives. President Donald Trump last month signed an executive order that resulted in financial aid to the global HIV response being abruptly halted. Let's bring in Sibongile Tshabalala. She's the chairperson of the TAC. Sibongile, it's great to talk to you. Thanks very much for coming on. I want to get to the impact on the fight against HIV and AIDS in just a moment. As we know, the withdrawal of this funding has many, many layers. And one of those layers is that the people who work in the sector found out, as we just heard from Malungelo Boy's guest, found out with a moment's notice that they had dropped, that they had lost their jobs. What does the future then in this context look like for the operations of the Treatment Action Campaign?
Good day, Michelle, and the viewers at home. What has happened in the past few weeks, it is very devastating, and it is a call for concern, as it was indicated earlier in the news. And we see a lot of, we are going back to where we are coming from as a country, and also as people living with HIV. And the impact of this stopping order or determination, it's really concerning, because with all that we've been fighting on and what we've been trying to achieve, it seems like it's just ending as it is now. So in future, what we are anticipating is that we are going to see a lot of people being lost to care. We are worried about the sustainability of the HIV program in the country and around the world, and also we are worried about that we set out for ourselves, and including America signed those goals, like the UN goals 95, 95, 95, 95, and also the 2030 goals of ending new infections. So as activists, we are really worried to say, with all the work that we have done, with all what we have been fighting for, we see ourselves going back to where we are, because with the loss of this funding, as much as you spoke about people losing their jobs, with the issues of economy that we are facing at the current moment, a lot of people will have no jobs, and also will lose skilled people in the facilities, in the healthcare system, who were assisting in terms of providing healthcare services, especially to HIV programs.
Yeah. For the work of the Treatment Action Campaign, Sibongile, how have your operations been impacted? Have you had to let people go?
Yes, unfortunately, we had to stop some work that we are doing. We know one of our biggest project, which is a Rechitsa project, community-led monitoring. It's mostly affected because it was funded by PEPFAR through USAID, and we received a stop work order, and we are now retrenching. We are not yet sure now how many people that we are going to retrench, but all our staff members through that project are being laid off, and we are going through the process of retrenching. So it's a huge take back for us, because that project, it has assisted us a lot, not as people living with HIV only, but as a country also to improve our healthcare, our service delivery when it comes to HIV programs.
Yeah. 25 years of the Treatment Action Campaign and the incredible and important work your organization has been doing alongside other organizations. I imagine for people like you, for people who have been laid off, people who were working in the sector, not only because it was a job, but because they were so passionate about the cause, this must be a very despondent moment for you.
It is, it's really heartening, and it is very difficult. Also knowing that how many people will suffer out of this. As we are talking now, there are 8 deaths that are not recorded. There are 8 deaths that we are not talking about. There is TB infection rate that and TB deaths that are not fully recorded. So without the funding, without us monitoring the healthcare system, people will die. And the unfortunate part, people who doesn't even understand the politics of Trump and the US are the ones who are going to be suffering more. And, you know, it will create so many problems, not for only for us as South African, but for the whole community of people living with HIV globally and key and vulnerable populations. So this is really, it's really hard for us to deal with, and it's a really hard thing to swallow, to think that we have fought so much, we have come so far to be where we are, and by just one person's decisions, everything is just collapsing just like that.
Sibongile, you've been talking to us about the 2030 goals, 95% of people being viral suppressed, ending new infections. 2030, 5 years away, such incredible work that's been done over decades. If this funding is not replaced, some projections say South Africa could have over 500,000 additional new infections and over 600,000 more deaths from the virus by 2034.
It's true. And, you know, that is why as activists, as much as we have limited power to encourage the US president to restore this funding, but also we are encouraging our own government and governments to say they need to close this gap. We need to fight with them. We need to work together. They need to come up around the table. We need to see how this gap can be closed. And with all the issues of budget and budget austerity that we've been experiencing the past few years, we are really worried to say our government will be able to do this. But knowing that there are resources in the country, as much as they are not allocated to healthcare services, we are urging the Treasury, the government, president to look in the resources that are available in the country to close the gap, because if they were able to save like your SAA, ESCOMs and other entities, government entities, now it's time for them to take that hard decision to save our lives. What we need more, it's our lives to be saved. We cannot afford to die after surviving so much. For instance, I've been living with HIV for 24 years. So if I'm going to lose my medication now and die, that is not something that I've been wishing for. I wish that by this time we will be speaking another language to say there are new infections we are reducing, and we are able to put more people on treatment, and the language of HIV infections and HIV deaths, we need to change that language. So we need government to put all the energy that it can, and they need to use the constitution to use available resources to save lives, because a right to life is very important, like a right.
Well, Parliament is this afternoon at 2 o'clock debating this very issue. And as we know, the budget will be tabled on the 12th of March, next Wednesday. So we'll have to see how not only the debate unfolds, but how the money is dispersed insofar as reaction to this cutting of PEPFAR funding. Sibongile Tshabalala, thank you for your time this afternoon. She is the chairperson of the Treatment Action Campaign.